cisterna hyli, that is beginning of thoracic duct, or sometimes it opens into lumbar trunk, usually into thoracic duct. Truncus intestinalis, it is inconstant in 20% of cases. We will speak only about constant trunks, about lumbar, bronchomediastinal, subclavian, and jugular. That is general information about lymphatic system, some words about lymph nodes. It has capsule of lymph node, and lymph node has hilum of lymph node. And opposite side from hilum is, we can see afferent afferent vessels. These vessels bring lymph to lymph node, and after that lymph passes through lymph node. And here in lymph node we have sinuses, subcortical sinus, cortical, first is subcapsular cortical medullary sinus, and portal sinus. And from portal sinus, lymph flow away from lymph node through afferent vessel. Here it is afferent vessels, and here it is afferent vessels. In cortex of lymph node, we have lymphoid tissue, this place where lymphocytes take place, where they grow, where they present, and yes, they receive their functions and comes to lymph from lymphoid nodules in lymph node, from lymphoid tissue of lymph node. What else? Some words about lymphatic drainage. Today we speak only about lower extremity and pelvis. Look here, this is foot. Big toe, second, third, fourth, and fifth. In lower extremity, we have two types of lymphatic vessels, the same like blood vessels, which superficial and deep. Superficial vessels from skin and subcutaneous fat passes along of two superficial veins. From first, second, and third toes, lymphs flow along of vena saphena magna, and these lymphatic vessels near of vena saphena magna goes to superficial inguinal lymph nodes, and superficial vessels from fourth and fifth toes to near of vena saphena parva, where vena saphena parva finishes in popliteal. That is why these vessels, superficial vessels, goes to popliteal lymph nodes, lymphnodi poplitei. And all deep lymphatic drainage from deep structure, from muscles, from joints, from ligaments, from all deep structures, deep lymphatic vessels, the same goes to popliteal lymph nodes. From popliteal and from superficial inguinal lymph nodes, lymph flow to deep inguinal, from deep inguinal into external iliac, from external iliac into common iliac, from common iliac into lumbar lymph nodes, and from lumbar lymph nodes we already know that we have lumbar trunk continues into thoracic duct, and thoracic duct opens into left venous angle. And when you will write lymphatic drainage from lower extremity, popliteal, superficial, inguinal, then deep, you will write deep inguinal. From deep inguinal you put arrow, that is external iliac lymph nodes. From external into common iliac lymph nodes, then lumbar lymph nodes, then lumbar what? Trunk, truncus lumbalis, then beginning of thoracic duct, that is cisterna hyli. Cisterna hyli. And from this cistern continues into ductus thoracicus and ductus thoracicus into left venous angle. Cleatis, that is cisterna, thoracic duct, and left venous angle. And left venous angle. And it is not so important, that is superior vena cava. Left venous angle, that is from lower extremity. Now, some words about organs of pelvis. For example, rectum, from rectum. Today you already answer venous outflow. From upper part of rectum, which vein?
Inferior mesenteric.
Rectalis superior into inferior mesenteric vein. And lymphatic drainage from upper part of rectum, the same goes to lymphanodi mesenterici inferioris. If we have truncus intestinalis, in this case truncus intestinalis goes to thoracic duct, but you will answer that from inferior mesenteric lymph nodes, lymph flows into truncus lumbalis, then cisterna hyli, ductus thoracicus, and left venous angle. From middle part of rectum, lymph flows into nodi lymphatici iliaci interni. The same in pelvis we have lymphanodi sacralis, and from all of them lymph goes to lymphanodi iliaci interni, and then lymphanodi iliaci communis. Sorry, it is sorry. This is iliaci communis, of course. That is iliaci. This is internal iliac and sacral. From them into common iliac, then lumbar lymph node, then truncus lumbalis, cisterna, thoracic duct, and ductus left venous angle. And from lower part of rectum, lymph flows into what is it? Superficial inguinal. From superficial inguinal into deep inguinal, external iliac, common iliac, lumbar trunk, cisterna hyli, ductus thoracicus, left venous angle. From uterus. This is vagina. From fundus of uterus, the same like from fallopian tube, and from ovary, lymph flows into lumbar lymph nodes, directly into lumbar, nodi lymphatici lumbalis, then truncus lumbalis, cisterna, thoracic duct, left venous angle. From middle part of from most part of the body, lymph flows into internal internal iliac lymph nodes, and from internal iliac goes to common iliac, lumbar, truncus lumbalis, and so on. And from cervix, and from upper part of vagina, the same into internal iliac and also into sacral lymph nodes. And then the same common iliac, nodi lymphatici lumbalis, truncus, and so on. And from lower part of vagina, lymph flows into superficial inguinal, deep inguinal, external iliac, common iliac, lumbar, and so on. From urinary bladder into internal iliac lymph node, then common iliac, lumbar lymph nodes, lumbar trunk, cisterna hyli, ductus thoracicus. Prostate gland the same like lower part of urinary bladder. Well, that is general information about lymphatic system. spleen, lymph nodes, and lymphatic drainage from pelvis and lower extremity. That's all.